Hello and welcome. My name is Linda Male, and I'm excited to have you along my leadership journey. My project is entitled Empower, a comprehensive SRHR project for youth, and I am the technical lead for sexual reproductive health and rights with Plan International, Malawi. Malawi is one of the youngest populations in the world, with over one third of population being around the ages of 10 to 24. However, these young people are affected by different SRHR issues. 29% of the girls are mothers before the age of 18. 38% of the girls are married before the age of 18, and almost half of the women experience physical or sexual intimate partner violence. The core drivers of these issues are restrictive laws, harmful social norms, and limited access to services that create a cycle of poor health and poverty. The objective of the project is, first of all, increasing knowledge and shift attitudes by delivering age-appropriate, gender-transformative, comprehensive sexuality education, improving access to services by scaling up youth-friendly SRHR services in safe and protective and supportive spaces, and also strengthening the protection system by strengthening the community-level child protection committees, and also enforcing laws, but also overall transforming harmful norms that negatively affect the young people. The project is going to use a number of frameworks, and one of them is Champion of Change for Youth Empowerment. Champions of Change is a peer-to-peer model that promotes gender equality. And we're also going to use Youth Advisory Panel at the center of the program design. For delivery and protection, we're going to use the Adolescent Pregnancy and Parenting Framework, which is a framework that strengthens young people who have gotten pregnant before the age of 18 in their positive parenting skills. We are also going to use Empower Model, which is a community-based approach to prevent and respond to violence. And finally, we're going to use the POWERS model, which is a form of comprehensive sexuality education, but that targets not only the youth, but also their parents. Realizing the need for inclusion, we're going to work in partnership with the government, with the community, with the civil society, including youth-led organizations and other international organizations, but also the media to amplify the reach and influence of the project. To track progress of the project, we have set up goals and indicators. The goal of the project is to create a protective environment where all youth, especially girls, can exercise their rights and reach their full potential. The three main indicators are reduction in teen pregnancies and child marriage rates in the long run, increase in knowledge and uptake of SRHR services, and also a strengthened community reporting and response mechanism for GBV. It is very important for Malawi to invest in SRHR project, and that is why this project is a very important strategic investment in Malawi's human capital. By advancing gender equality and improving public health and breaking the cycles of poverty, we are unlocking the potential of a young generation that is able to sustainably and positively contribute to the economic development of the country. Together, we can ensure a healthier, more equitable, and prosperous future for all Malawians. What has been done so far? We have been able to introduce the project to the district. This leadership journey has helped me as an individual to grow personally and career-wise. In authentic leadership, the project has helped me to champion core values of justice and equity by centering my work on the rights and potential of the most vulnerable girls. On inclusive leadership, I have been able to proactively identify and value all stakeholders in my work, from youth and community leaders to government and CSOs, as essential partners in collaborative ecosystem. But I've also been able to focus on sustainability. The leadership journey has also helped me in systems thinking, where I am aiming at addressing the root causes of harmful norms and poverty and interconnected systems. My call to action is for all of us to invest in this generation for a lasting demographic dividend to partner with like-minded institutions to scale impact and ensure sustainability, but also to champion SRHR agenda within our networks and institutions. To ensure sustainability of this project, we are working at strengthening the capacity of the local structures and government healthcare workers so that they're able to continue the work after the project has phased out. Thank you very much for listening to my presentation.